Hello, I'm Gemma, and during today's presentation I'll be discussing patient safety as an issue in relation to handover between the post-anaesthetic care nurses and the surgical ward nurses. I'll also be discussing the role of the post-anaesthetic care nurse when using effective communication and a structured approach when providing a safe handover. First of all, according to the National Quality and Healthcare Standards 2011, patient safety is described as being one of the national health priorities. Patient safety comes in many forms, but today I'll be talking about patient safety in regards to providing effective communication during the handover of professional responsibility and accountability of a patient. According to the Australian College of Perioperative Nurses 2016, a post-anaesthetic care nurse provides detailed care for patients who have just had surgery, which includes taking a handover from the intraoperative nurse and monitoring the patient until they have met requirements to be discharged to the ward. Once a patient has passed the requirements, they are then passed on to the surgical ward nurse, who has the duty of receiving an accurate handover from the post-anaesthetic care nurse so that they can proceed with the correct care for the patient. According to Mayer et al. 2011, handover is a communication of important patient information that occurs between shifts or between different caregivers and is communicated mainly through verbal, face-to-face or written forms. According to Jorm et al. 2009, there are a number of poor patient outcomes that can occur due to incorrectly communicated handover, such as medication implications like incorrect or double dosage and delays or failure to give treatments. Therefore, it is of utmost importance that the post-anaesthetic care nurse provides a detailed and accurate handover to the surgical ward nurse. It is the role of the post-anaesthetic care nurse to use effective communication when handing over a patient from surgery to the ward. The information a surgical ward nurse needs to receive includes patient identification, allergies, vital signs, patient history, the procedures performed and the name of the surgeon who performed it, anaesthetic used, any drugs given to the patient whilst in surgery or recovery, any abnormal occurrences whilst in theatre, and any post-operative orders. A study by Segel et al. 2012 also researched a number of ways in which the post-anaesthetic care nurse could improve communication when handing over, which included the recommendation of the use of a structured handover tool. There are a number of structured handover tools that nurses can use to provide a safe and effective handover, and one of which is the ISBAR handover tool. According to Thompson et al. 2010, the ISBAR tool has the power to improve handover communication as it provides a template which creates structured approach to handover, ensuring information errors within the healthcare teams are minimal. The ISBAR tool stands for Identity of the Patient, Situation, Background, Assessment and Action, Response and Rationale. To conclude, it is the role of the post-operative care nurse to provide effective communication when relaying important information within the handover to the surgical ward nurse. With the help of a structured handover tool, important information about a patient shouldn't be missed. If the information is received accurately by the surgical ward nurse, there should be minimal safety issues for the patients and therefore promote a positive patient outcome. Thank you.